Happy Wednesday again to everyone. I had to restart the video because the sound got cut off, but I will do a quick recap now that I already thought about what I want to say since my mind's a little disorganized. The gist of it is that on Wednesdays I do consults and I see 40 to 50 patients, try to educate them as much as possible. And every Wednesday I learn a lot myself talking to patients, and you kind of understand what they see, what they're concerned about. And that's how you learn fast actually as a doctor. So it's helped me a lot listening to patients. So what we're going to do is something called Lesson of the Day Wednesday. And that's Wednesday after Hell Day, after seeing all these patients. We say, hey guys, it's Wednesday. Let's do Lesson of the Day. So today's lesson of the day is talking about facial imbalance and how patients perceive it and where they can go wrong, because doctors don't see things right all the time. So one of those things is I've had 4 patients come in today saying that they wanted either a chin implant or buccal fat removal. They've felt like this because they had a slight bit of jowling down over here, little bits of depression, and they felt that the chin was recessed. And realistically, I looked at all 4 of them and it felt like a broken record. It's kind of embarrassing in front of my resident from Monterrey, hearing me say the same thing 4 times because he thinks I'm just like, maybe brushing people off. But what it was all 4 patients had excess in dental position. Their teeth and their maxilla was a little too prominent and it made their chin look small. The other thing that it does is it causes strain in the face, because as we close our mouth, the mouth has to close comfortably. You close it relaxing, you let gravity do most of the work. If gravity's not doing the work because the lip is stuck up on a large maxilla or prominent teeth, it's stuck here, try to close your mouth and you see now this lower lip has to work. And if you watch it, chin goes up, these muscles pull down and it contracts this area. So these patients end up getting prominence here. If they have wide teeth, even more prominence. If they have imbalance and strain, they end up getting masseteric hypertrophy too. And not in the back of the masseter, they get it in the front of the masseter. So they actually end up with a bulge right here. So they look broad right there and they have drooping right there, and they want to do buccal fat removal. So what happens to this patient if you do buccal fat removal when they don't have excess buccal fat? This thing collapses more, this thing deepens more permanently. You can't get it better. So it's a big mistake. What happens if you do a chin implant on somebody that looks like this? From the side, you had big prominent teeth, and now you made a big prominent chin. Now everything's coming forward. So rather than do that, you educate the patient. You tell them, listen, it's just that your teeth are prominent. That's why you're forming the resting bitch face, the RBF, where you kind of pull down. That's why you're forming these jowls. And they don't get it sometimes because it doesn't make sense. They came to a plastic surgeon. They don't want to hear about teeth. So they have to understand that all these things come into play when you're talking about facial balance. Now, if you look at the side of the face, we look at the chin and we compare it to the forehead. You don't always compare it to the nose and the mouth. Those are the in-betweeners. The forehead to the chin should be kind of like a saucer, and the saucer should start and end in about the same position. So let's say we're looking at a photo of me. Not so fantastic looking, but okay, there's me. Now, let's say, how does this guy work? Okay, I have a prominent mouth. And I bring my mouth forward because my teeth are forward, makes my chin look small. And some people would say, hey, let's bring that chin forward. Well, now my chin forward and my mouth is forward. Everything is drawn forward and that's elongated. So not fantastic. But let's say my mouth is forward. And then I say, well, let me bring that mouth back. Now my chin looks a little bit more normal size. So that's the idea of it. So let's say again, we bring that chin forward. What's going to happen, the mouth. When the mouth goes forward, this goes up. That's what happens to people. And if you look around, you'll notice that when people try to close their mouths with prominent teeth, their chin sits up here. It doesn't sit down there. And that happens because the mentalis gets stronger over time, and every time you close the mouth, it stresses. What also happens is you get resting bitch face. That thing falls down over there. And then on some people, you get exaggeration and jowling. So they get this appearance, and you go to a doctor and they'll say, that's buccal fat removal. It is not. Buccal fat removal here will cause a collapse over here. You'll get a depression. Everything gets worse. So what do? Boom. You just put the teeth back in, chin goes back down. You can Botox it to help take it back down. And this starts to relax. And if there's any residual, you do Profound, a radio frequency treatment that takes care of it. While we're at it, let's do a little bit of that. Fantastic. Maybe I should get a nose job. Let's do a little bit of that. Ooh, that looks nice. Parotid gland. Everybody misses that. Big parotid gland. Poor Benjamin. You want to tuck that up. That's what we do during a weekend lift and a facelift. Parotid gland is large. There you go. So if people try to build that out realistically, you got to bring it in. But okay. So as you can see, I've got image issues. So that is the lesson of the day, is that you have to look at the balance of the face and realize these things, that sometimes it's the teeth. It's not what you went in for, being the soft tissue. And if you leave those teeth alone, you're going to accelerate the facial aging process. Laura says I'm perfect. You're the best. So you're going to accelerate the facial aging and speech process. And you're going to accelerate resting bitch face. So that's what happens with people with prominent dentition. If you have an open bite where one side closes more than the other, now you're talking about big strain, lots of asymmetry. You're going to start twisting to one side and you kind of look like that all the time. That can be fixed with orthodontic work. And we do have a podcast that was done with Dr. Octavio Sintra de Brazil, and he explains and shows all those changes. And this is actually, all right, so maybe I should do that stuff. But there's a good podcast that explains about this facial aging and facial strain. But there's so much contribution from the teeth onto the face. It's a shame that more facial plastic surgeons and plastic surgeons aren't aware of it, because they end up doing the wrong procedure. All these patients are getting chin implants, they're getting facelifts, they're getting buccal fat reduction when it doesn't really help. And all they really needed to do was send them to an orthodontic specialist or an orthodontic specialist like Dan Grauer. All right, so that's lesson of the day. It is 6 p.m. I run to the gym between 6 and 7, and then I come back up to work. So I'll post this, and next week we'll see what pattern presents itself that day. And we'll just base it on that. And Dr. Ernesto Teorel, he's the guy in Mexico who's amazing.